A person's care plan is going to depend on four things: what is feeding the breast cancer, where the breast cancer originated, how progressed your cancer is, and as evidence of genetic predisposition. So, what is feeding your breast cancer? There is the no, no, and no. That is it's triple negative cancer. It's where it's unknown what is feeding the breast cancer. Um, One of my closest friends had triple negative breast cancer, and this means that the doctors don't know what fed her cancer. When they did tests on her biopsy, the tissue sample didn't respond to estrogen or progesterone receptors, nor to HER2 proteins. Thankfully, she got the breast cancer early on, and they only gave her a mastectomy. That doesn't mean she has had an easy journey by any means, but her treatment was different from another friend of mine. And then there is another friend of mine that also had breast cancer, triple negative breast cancer, and maybe it was a difference in age or body type, or maybe she didn't catch her cancer as early as my other friend. But her treatment was different than my first friend. She had a mastectomy, radiation, and several different chemotherapies. Both of them had the same type of breast cancer, but they had different treatment plans. Then there is the yes, yes, and yes. It's the polar opposite of triple negative breast cancer, and that is triple positive breast cancer. Triple positive breast cancer feeds off of all three main indicators. It's on the other end of the spectrum. It feeds off of both estrogen and progesterone receptors as well as HER2 proteins. A person with triple negative breast cancer will most likely be treated with several different chemotherapies, but her treatment plan may also depend on how early her breast cancer was detected, how old or young she is, how aggressive the cancer is, her body type, genetic testing, and other factors that are determined by a team of oncologists. A HER2 positive hormone negative breast cancer feeds off of HER2 proteins and has no other indicators present. A HER2 positive breast cancer feeds off of HER2 proteins, and there are no other indicators present in the testing of the biopsy sample. The cancer cells present in the biopsy tissue have a gene mutation that results in excess HER2 protein. While this type of breast cancer has a tendency to be more aggressive than other breast cancers, the treatments are also found to be just as effective as the cancer is aggressive. While a majority of HER2 positive patients are younger women, that does not mean that an older woman won't be diagnosed with a HER2 positive breast cancer, either HER2 positive alone or triple positive. Then we have hormone positive HER2 negative breast cancer. Hormone positive breast cancer is positive for the estrogen and progesterone indicators. Breast cancer feeds off of estrogen and or progesterone in a hormone positive breast cancer. Around 80% of breast cancers are ER positive. They feed off of an excess of estrogen in the body, and 65% of these same ER positive breast cancers are also progesterone or PR positive, additionally feeding off of progesterone. Either one of these indicators results in a hormone positive diagnosis. If HER2 is present as an excessive protein as well, then you will be further diagnosed as triple positive. If there's a lack of HER2 protein present, then you will be diagnosed as hormone positive. The good news about a hormone positive diagnosis is that your cancer is much more likely to respond to hormone therapy. Almost all treatment of hormone positive breast cancer involves some type of hormone therapy to block the effects of estrogen. What stage of breast cancer you have will determine additional treatments such as chemotherapy, radiation, mastectomy, or lumpectomy.